One of the big things that made me choose St. Joe's was the fact that there's a big focus on procedural skills and ultrasound. I knew that coming into St. Joe's that I would get that experience, and I think that's been something that's been a huge help and like a huge plus for this program.
We get tons of clinical exposure to lots of different things from, bread and butter medicine to what we call zebras, very uncommon diseases. And I think that is a testament to how diverse the Denver population really is.
I tell everybody all the time I would put our residency program up against pretty much anybody in the country for our ability to train in all aspects of internal medicine.
As interns first come here, it can be very anxiety-provoking to be working here all the time and dealing with all these new responsibilities. But residents do a pretty good job basically every single day, especially early on, checking in with one another and seeing how people are doing.
We're a small enough program that most everybody knows a lot about each other. And if someone's struggling, we're there to help each other.
I've walked in and felt immediately supported by all of the faculty and our program director and my co-residents. And they are really they were the support system that allowed me to grow and flourish in this job.
Something about the program that I also saw as a big strong point was the fact that you get a lot of autonomy with this program. You don't have to battle with a whole bunch of fellows for getting procedures, for seeing patients, etc. So I feel like that's been a big strength, and I've been able to grow a lot as a physician, being able to take a lot of ownership for these patients.
In helping residents just kind of discover how they like to practice medicine, I'd start off by giving them my kind of goals, my objectives for spending a week with them inpatient or during their journey through 3 years of continuity clinics. But it's also important for me to kind of understand who they are as persons, what their personal goals are.
Our program director really early on wants to know, are you interested in research or fellowship, or do you want to do outpatient primary care? And he really puts you on that right track and gets you in touch with the people that you need to be in touch with. I think being part of the St. Joe's community is an absolute pleasure and a privilege, because I am walking away from this experience with so many friends.
I'm usually hanging out with the resident outside of work at least once a week. So it's quite often that we're having some sort of event, even if it's just going to a restaurant or bar down the street, in the winter going skiing, going on a hike.
I just think that the natural beauty of Colorado is so fantastic, and it's conducive to wellness in lots of ways, in that you could just go on a hike or go do anything outdoors, and it's free, and it's really a wonderful place to live.
If I was going to talk to my past self from over 2 years ago, the biggest thing that I would probably tell myself is just you wait. Just you wait to see how far you'll come, because you're gonna be shocked. It's gonna be a good time, it's gonna be hard, but it's gonna be some of the most rewarding years of your life.